All right, continuing our full body Batman suit demonstration. We have the myofascial meridians mapped out here so that we can see where the superficial back line would go, how it interconnects with the spiral line, which is more lateral. You can see down the side of the leg and bottom of the feet. Plantar surface is connected to everything up and down. So a couple of things to think about, which we can do with fascial techniques, which are slow, sustained shearing pressure. Basic myofascial drag. We're going to have both palms, flat hands, no or little oil. A myofascial drag is going to be imagining we're planting our hands in one spot and kind of pushing the whole bodysuit away. So I can take pressure off of the top of the head by tugging that superficial back line downhill. Inferior is going to create space. We talked about making space, opening up room for the joints of the cervical spine to do their thing. It is not uncommon to hear some clicking and cracking and something that a client might mistake for an adjustment, a chiropractic adjustment, when we're doing an extremely low velocity movement, as opposed to chiropractic, which is higher, faster velocity. And I would just sit on this a minute, 90 seconds, 5 minutes if you had to sometimes. And again, I'm just leaning here. I'm not even working. I'm not doing anything. I'm just holding myself up. And that should feel good to him.
I felt really nice when you let go.
Right.
It's like,
Same thing, we talked about making space or a micro stretch of the low back. You can do a crossover pattern where I'm not pushing into the sacrum. I'm thinking this line. How can I move the bodysuit all the way down to here? How can I push this tissue that's bunched up there where there's typical strain patterns toward the hamstrings, for example, here. And I could do that cross side. I'm just stretching, like there's a tiny bit of space between my two hands, and I'm just going laterally, sideways. Another really good one that fits very well in a spa type setting, more than a clinical deep tissue kind of place. You could do a stretching across the back to the opposite hip, or get both forearms in there and just lean on that. Super easy. Let them breathe. 30 seconds. I can slightly adjust my left side, my lower forearm. I'm being very careful not to use like pokey, pointy pressure. I'm spreading like that rolling pin we saw with the big dough ball. I'm trying to just smooth that down and out. And I'm kind of counterbalancing over here. Not really much pressure, it's just kind of creating an anchor so that I don't yank this whole thing down. His whole cape doesn't come with me. Another thing I love to do is help the client understand that everything's connected, and even though they might be feeling like they need only work in the back, you can help them engage the entire body by bending the leg and putting a hand in the low back and slightly pulling that out. That's internal rotation of the head of the femur. Or we can push this up here, and you can kind of see the movement if I move that cape over there, right? That makes sense?
Yes.
Seeing some of that? And you can kind of plant on any spot along that superficial back line and let it go for a few seconds. You can put the leg the other way and kind of play around with this stuff and see how that changes with the hip flexor. And the front line, you can imagine, is doing an opposite motion of the back line. We can try to pick up the lats. And I'm barely putting pressure. I'm just moving, I'm sinking in enough to hook into the fascia. I'm not even thinking about specific muscles at this point. It's just regional, big picture. Or also for that lat, I can pull the arm up here, and you can see how that moves where it crosses under here into the spiral line. This kind of movement is moving this stuff underneath on the front, and it's moving that SCM and all those good neck muscles. The suboccipitals are engaging. There's movement here in the hood just by a simple arm movement. And I don't even have to stretch him per se. It's just movement. Just where does his joint stop me from moving further? And I can pick this up, move this around. I can go opposite, away from it. I can pull tissue towards it. If he's got a lot of low back problems, I can create some slack down here by pulling this up. So I can get deeper into here without having to beat up layer after layer after layer to get down there. If that all makes sense. We are going to talk about assessment. I start almost every massage by this gentle rocking motion, which is super easy on you, again. And the purpose of this is to see what's moving and what's not moving. In theory, the spine has a nice serpentine, easy, relaxed movement. I should be able to figure out if one side is tighter than the other, one side's overdeveloped, one side's weaker, one side's damaged or injured or strained, or there's spasm in the muscle tissue. I should be able to see from the top of the head if something's going on to the feet. I should be able to see. Even when there's a sheet on top, you can see a lot of times. A lot of cues that are going to tell you where to go next. And I can also kind of shake up here if I want to feel, if I see more tension here under the underarm and stuff, I can kind of get a little feel of what's going on there. I can start a massage a lot of times by kind of compressing and rocking from the legs. Is one of these lateral spiral bands pulling more or less or fighting me as I touch that? You know, if I just do a quick little fist into the side, like the TFL area, glute medius, I'm seeing a lot of good motion down here. That looks good to me. I wouldn't waste much time per se in that area. But this one, I wouldn't waste time trying to help this leg because I'm seeing tension here where this foot is flopping out, telling me this spiral line here is tighter and pulling this foot out like that. If you see that, what I'm talking about. So once we get on the table without all the layers and layers of suit, we'll be able to hopefully see that quickly on the skin. I also love to do that little like squeezy on the back of the neck, kind of like lift that stuff off and away from the cervical spine, because it can get real uncomfortable real quick if I start digging into scraping out that lamina groove of the cervical vertebrae directly. Pushes their head down into their face rest and can get into their neck. Pressure on the front, it's uncomfortable. So that's what we were talking about with lifting motion. Lifting, just taking it away from the body as another choice of stuff we can do. All right. Any other questions about Batman before we get moving?